I'm Dr. Nigel. I'm the Chief Executive of the Oral Health Foundation. So, used to be a practicing dentist, but been running the charity for the last 25 to 26 years. And we're a not-for-profit. We're a charity promoting benefits of good oral health to the public.
Can you describe the daily tasks that a dentist would be responsible for performing on a day-to-day basis?
Obviously, dentists perform a wide range of tasks as part of their daily duties. I mean, their basic interest is in keeping their patients with a mouth. So that will vary through routine dental examinations, through to cleaning the teeth, scaling, polishing, maintaining the gum health of the teeth. And then if people have got problems, they'll be looking at doing the various restorative means that are necessary to put people's right. So that may be from filling through to crown and bridge work, and then in a more advanced way, things like implants and restorative dentistry.
What is the process of when you're getting qualifications or going into dentistry?
Dentistry is a 5-year unit course, gives you a degree of Bachelor of Dental Surgery. There are around 15 dental schools across the country. Obviously, some people have come in from abroad as well, from the EU and other countries. So it's a very intense university course with long years, which then entitles the dentist to practice after they've done a further 2 years foundation training to build on the skills that they've got at university.
What gives the dentist the most pleasure in providing the best possible experience for their patients?
Dentists are always looking to provide a good experience for their patients. Now, many people, as we know, are nervous about going to the dentist. So dentists will spend quite a lot of time trying to put their patients at ease and provide a totally pain-free experience, which dentistry should be. They will get the greatest pleasure in people having a healthy mouth and not needing to have dental intervention and fillings and so on. So prevention is increasingly important. And then we need to look at the value of the smile. I mean, our smile actually leads us into feeling better about ourselves. Having a nice smile helps us when we're getting a job, how we get promoted during the job. So there's quite a psychological aspect to having a good smile as well and good oral health. And then we also need to bear in mind that increasingly these days we're aware of the links between health of the mouth, gum health, and general health. So we would say that you can't have good general health without having good oral health. There are links with diabetes, with cardiovascular disease, with poor pregnancy outcomes. So, actually keeping those teeth and gums in order has additional benefits for the rest of the body. Well, you aren't actually registered with a dentist. You sign up with it, unlike the doctor, you sign up with a dentist just for the course of treatment that you're going for. Many people think that they are registered with a dentist, but that's not actually the case. We do know that we've got a huge shortage of NHS dentists in particular at the moment, and it can be very difficult to get on a list. And really, it is a question of perseverance, finding dentists locally that are accepting new patients, and indeed, as you say, Abu Bakr, there may be a wait for that.
So why is it important to brush your teeth every day? Can you give us some long-term benefits?
Well, as we said, we're really looking at prevention. We want to prevent any disease. brushing twice a day with a fluoride toothpaste, last thing at night and on one other occasion, is the best thing that we can do to help prevent us getting cavities. And cavities are caused when the sugar in our foods meets the bacteria in dental plaque if we haven't removed that when we're cleaning our teeth. So those cleanings are very important. The length of time that we clean for is very important. Dentists recommend that you clean for 2 minutes twice a day. And we know that as a nation, we only actually tend to clean for less than 45 seconds. So we're only doing half the job that we should be doing.
How can we time the 2 minutes? Is there any brushes out there that time like electrical manual ones, or how can we time ourselves for 2 minutes? Because I tend to do it less than 2 minutes as well sometimes. Sometimes I do it for 2 minutes, but majority of times, like you said, I do it for 10 seconds, 25 seconds. So what's the advice around that?
It is quite difficult to actually get up to the 2 minutes. It's longer than you think. So aids to actually help with that are really useful. Now that can be as simple as a little egg timer. You can get little egg timers that will time you for 2 minutes. Maybe play a favorite song for 2 minutes or something like that. Through to the, as you said, the electric toothbrushes, the power brushes, which very often have 2 minute timers on, and indeed they'll probably have 30-second timers so that you can do a quarter of the mouth at a time leading up to that 2 minutes in total.
Should people use mouthwash as well once they've done the brush their teeth on a
Mouthwash,
basis?
mouthwash is a good addition. A lot of them contain fluoride. They nearly all contain antibacterials, which will help to fight that bacterial plaque on the teeth and reduce its formation. So a good addition to toothbrushing and can help attack that we've missed when we brush. So, yeah, by all means, add a mouthwash into your routine.
What is your advice about habitual brushing, a routine brushing every day?
As we said, what we really need to look at for brushing is at least twice a day. The one last thing at night is the most important because our tooth's natural protective mechanism is the saliva flow. And when we sleep, our saliva flow reduces. So that last thing at night, brushing just before we go to bed, is really important. And it's the one that people can tend to skip because, different priorities come into the day. They've been out late, etc., etc. Oh, we'll brushing before we go to bed, but that really is the most important one.
So does that maintain the saliva flow then if you brush late at night before you go to sleep?
It doesn't maintain the saliva flow brushing last thing at night, but what it does do is it coats the teeth with the protective fluoride, which helps prevent decay and strengthens the teeth. And that really then helps with keeping your mouth healthy.
What food or drinks you should avoid, like in Islamic religious minority, there's some things that you have to avoid. So what should you avoid?
Really, the enemy here with regard to teeth is sugar. So it's free sugars, and as a nation, we all eat far too much sugar. Free sugars should only form around 5 to 10% of our diet, and they're far more than that in the diet. So watch the amount of sugar. Have a look at the food labeling. It will be surprising how often sugar is there as an ingredient. Maybe number 2 or 3 on the list of ingredients. Cut down on those sugary foods.
How long does protection last with a single brushing with most toothpastes?
Well, really, as we've said, you need to be brushing twice a day so that protection will last then through the 24 hours. But you do need to get those twice daily toothbrushings in.
Yeah, Abdullah, I can answer that as well because with my brush, when I'm doing it, it's quite very bad when the sticks on the brush they're like broken because the way I brush it is quite hard and it's normally terrorized. So I tend to use a different brush after every 2 to 3 months. So what brush would you recommend to anyone that out there has a disability or who's got a visual impairment or if they're disabled?
Certainly, there are lots of things available for people who've got limited mobility with their hands, whether that be from rheumatism and arthritis in old age that you can't grip. So the electric toothbrushes tend to be wider and easier to grip, so that can be one answer. But you can also put, there are various aids out there available for the disabled patient, putting a bicycle handlebar rubber on so that you've got something thicker to grip. You can get little polystyrene things to put on. So this is something to discuss with your dentist, and they should be able to help you with that.
So, which toothpaste would you recommend to use regularly, and it gives you the best oral hygiene?
Lots of toothpastes out there that you can pick from. The basic thing that we're looking for in a toothpaste is the fluoride in the toothpaste. Don't be tempted by a non-fluoride one. So fluoride in the toothpaste will be the thing that helps protect you against decay. And then there are specialist toothpastes available if you've got tooth sensitivity or particular things with gum disease that will concentrate on those things or whitening the teeth. But the key ingredient you should be looking for is using a toothpaste with fluoride.
So when do you mean by fluoride? Could you just explain that to our viewers and like what do you mean by that?
Fluoride is a naturally occurring element. It occurs in our water naturally. There's very few areas in the country, and Manchester isn't one of them, where fluoride is added to the water to the optimum level to help prevent decay. So it's a naturally occurring substance. And has been responsible in toothpaste. It came into toothpaste in the late 1960s, early 1970s. And that addition alone as a toothpaste ingredient has been responsible for reducing decay levels by a quarter to a third. So, it really is an important ingredient in toothpaste.
So, like in our religious background and different cultures, how can we find out that if anything contains alcohol or that's not vegetarian on the toothpaste or mouthwash? How can we find that out?
There are vegan toothpaste out there that will carry vegan certification. In terms of alcohol, again, this will occur on the list. Mouthwashes these tend to have much less alcohol than they did, and a lot of them will be listed as alcohol-free. No alcohol toothpaste per se, so you're not going to find that. So it's a question then of looking at the other ingredients and checking that there's nothing that is not going to be vegan or vegetarian. But there are toothpastes out there with vegetarian and vegan certification.
So, like yourself, you've been in this organization for such a long time. And how do you base it around your family and your work and luxury leisure time? How do you base it all and how do you balance it?
Work-life balance is not as good as it should be. I'm a bit of a workaholic, so and spend a lot of time traveling. We don't just operate in the UK. There's a lot of international conferences and so on that we attend. So I guess at my age now, looking forward to retirement where I get a bit of work-life balance back.
So, what are the repercussions of not following a daily routine of brushing your teeth?
Obviously, we want to get that twice a day daily brushing in. If you're missing that, then you're going to stand a greater chance of decay and gum disease. So, you know, it's a good preventive measure. Both decay and gum disease are totally preventable by a combination of twice daily toothbrushing, adding in mouthwash if we want to, and also cutting down on sugar in the diets. But it's that mechanical removal of plaque through the toothbrushing process, brushing for long enough, that's actually going to really give us the benefits and give us good oral health.
What are the treatment options if you are not maintaining your brushing timings when you don't brush on time?
Brushing timings per se are not too critical. We do want to get that last thing at night brushing in, but missing brushing longer term is going to potentially lead to tooth decay. It's going to lead to gum disease. Looking at gum disease, the early indication of gum disease there is if your gums are bleeding when you're cleaning your teeth. That indicates that you've not been cleaning them well enough. So it's not a reason for off on the brushing. It means that you really need to pay more care and attention. So we do really need to look at that gum disease, because it's the gum disease that then links with some of the other general health conditions. So keeping our gums healthy, reducing the sugar, and preventing getting cavities is going to be key to having good oral health and good general health.
You might have seen the amount of loss in this year or in the past couple of years of the money and treatments getting expensive. So people are going to other countries to get the treatment done on their teeth. So how can we get this down and get a cheaper treatment done in the country, in UK? And why do you think it's expensive to get a treatment done in the UK?
Basically, I mean, in terms of the UK versus other countries, it's a question of general cost of living. In fact, it's not hugely expensive in the UK compared to many other European countries. The big problem that we've got at the moment is the supply of dentists in the UK. Post Brexit, then we stopped getting an influx of European dentists. We've got a huge shortage. Dentists are very unhappy with the current NHS dental contract, and as a result are tending to move away from NHS practice towards private practice, which makes the problem worse because private dentists tend to see less patients a day. It's not going to be a problem that's going to go away easily. There's not an easy solution to it. We're seeing dental deserts in various parts of the country, largely in the rural areas, but it can be a real battle to get seen by an NHS dentist at the moment. And I'm afraid there's no easy answer. It's just a question of perseverance.
How early is a child encouraged to brush their teeth?
We really want to get that idea of cleaning the teeth in as soon as the teeth start to come through. So the mother can hold the baby, and there are little things that you can get to put on your finger, or even just gauze on the finger to clean those teeth as they come through. And then as they come through further, there are little baby brushes that the mother can use to actually get those teeth clean. Install that routine early. We've been talking about 2-minute brushing and the fact that people don't tend to brush for 2 minutes at a time. In fact, we need to establish that routine in children at an early age. So we would recommend supervising children's brushing up to the age of 7. and making sure that they're brushing for the 2 minutes. I mean, it's easy for parents to be aren't brushing for 2 themselves to not get the children into that habit of brushing for 2 minutes. And that's really what we need in order to establish good habits for a lifetime.
So what are your pieces of advice for children, and then adults, and then elderly people on how to brush their teeth with the same pattern of brush strokes?
It doesn't really matter. I mean, there are many different ways of cleaning the teeth, and what we tend to do as dentists and our colleagues as dental hygienists is to adapt the method that people are already using to get the best results. We would all generally say, angle the bristles down towards the gum and then sweep upwards, because that's helping to clean in between the teeth. And another important thing that we haven't mentioned, we mentioned mouthwash, but we didn't mention cleaning in between the teeth. And actually cleaning in between the teeth daily with an interdental brush, these little bottle brushes that you can get, that really helps to get at the areas where both decay and gum disease start. So if we're looking at 3 key messages for people to follow: brush regularly twice a day with the fluoride toothpaste, last thing at night, and on one other occasion. Cut down on the amount and frequency of sugary foods and drinks, and visit the dentist regularly as often as they recommend, despite the challenges that we know we've got in that at the moment. They will recommend an interval based on your oral health. So if you've got really healthy teeth, you're looking after them well, you're cleaning them well, you haven't got gum disease, they might extend your recall interval out to 12 months, 18 months, even as far as 2 years. If you've got a high experience of decay, gum disease that needs treating, then they're likely to want to see you every 6 months, and indeed possibly every 3 months if you need regular scale and polishing and maintenance of your gum condition.
So people who are elderly and over 60s, or if they're diabetic, any elderly person or person is diabetic or has a disability, what advice would you give to them? Because if they've got type 1 or type 2 diabetes, what would you recommend them?
Diabetes is particularly important because there's a two-way relationship between diabetes and gum disease. We've always known that people with diabetes tend to suffer from more gum disease. Now, recently it's been found that their diabetic control is likely to be worse if they're suffering from gum disease. And also there's a two-way relationship. If you've got gum disease, you're more likely to develop diabetes. So a really key area to concentrate on. Very important that diabetic patients get regular oral health. If you're diagnosed with diabetes, then actually you should be seeking out oral health appointment early on and really maintaining those gums, because it's going to help you with your general health with diabetes. There's a lot of oral health information available on the Oral Health Foundation website, and that's at dentalhealth.org. So wealth of information there on all aspects of oral health and dental treatment.